Here.
Martel,
Here.
Joanne is absent, Christine is here, we have a vacancy, and Andrew is absent, and Courtney?
Here.
Okay. I'm gonna open the meeting, and I need a motion to approve or any corrections to the minutes from last meeting. Anybody notice any corrections? No corrections, I need a motion to accept the minutes. Need a second? Rita? All in favor?
Aye.
Moving on to old business, we have the dog and cat licensing. The dog licensing is at 462, and the cat licenses is at 86. Do we have anything outstanding still?
Summonses wise?
Yes, okay.
Yeah, I believe they're still outstanding summonses.
Okay.
Yeah.
New business, the ordinance,
Can I go back to old?
Sure.
quickly? I just wanna remind the board that, the flu clinic for the borough is scheduled for this Thursday. The nurses will, bless you, the nurses will be at the senior meeting from 10 to 12, and then it's open to the community from 3 p.m. to 6 p.m. here at the community center, and that's Thursday the 16th. We put an order in for more COVID vaccine because we've been going through it, and so we're hoping we should have it for the clinic on Thursday, but if not, residents can call us, and we're able to bill insurance, so we can tell right then and there if somebody's eligible for the COVID vaccine. So that's really awesome. I had talked to the board last meeting about the unknown related to the eligibility and the insurance coverage for the COVID-19 vaccine, and then I think that night the governor had come out with an executive order saying he was gonna expand access. So the access is there. I have not personally heard about any issues with insurance, but like I said, Randolph is using a program called VaxCare where we can actually check eligibility in real time and see if insurance is gonna pay for vaccines or if they kick it back, and so we then are able, if somebody doesn't have insurance coverage, we have another route to be able to provide vaccines for them. So, I just wanted to circle back on both of those things.
good, thank you. Moving on to the new business, the ordinance 2524, amending chapter 261, health and sanitation. That we had finalized at the last meeting for the fee schedules, changing over to risk type. For risk type 1 would be an $80 fee, risk type 2, $120 fee, risk type 3, $200 fee, risk type 4, $250 fee, and for grocery stores, a $400 fee. And that would be our starting points for coming year of 2026, and in the future, we could reevaluate those. I need a motion to accept those fees.
I make a motion to accept the fees as written.
I need a second.
I'll make a second.
All in favor?
Aye.
Any other new business that anybody has? Is there any correspondence?
No.
Okay. Open the floor to the public.
Nothing tonight.
Nothing tonight?
inspections done in September, we have 48 certificate of habitability inspections. I think a big chunk of them were from the Ramada. We had 22 food and drink inspections, food and drink re-inspection, 1 visual lead inspection, 10 mobile food vendor inspections for a total of 82 inspections in September. And then as far as complaints go, we had 10 environmental OPRA requests and 1 vermin complaint for a total of 11 complaints in September.
I have a question. The remodelable, I don't understand that, I don't know what that is. You said it was higher because of the Ramada.
We do inspections to make sure that all the rooms are
Oh,
meet
okay, so
code.
it's a hotel, the hotel.
The hotel, yeah,
So
behind
each,
is a new restaurant,
each
yeah.
unit is considered one inspection.
Correct.
Okay.
Yeah, so there were a bunch of inspections done there, and there are, I think inspections are scheduled for this month, so they'll be back there as well. Moving on to the public health nursing report, there were 3 phone calls, related to nursing requests and referrals made from 3 different, children, and there was an office visit from one of them. For childhood lead poisoning, there were 4 children screened, there were 2 initial capillary positives, there was 1 positive venous lab, 4 cases were closed, and there were 2 telephone calls and follow-ups made to those cases. Under child care consultation, there was medical exemption guidance provided to Lincoln Elementary School, and there was immunization guidance provided to TJ Middle School. Under blood pressure screenings, there were 2 home visits conducted for blood pressures by the public health nurses. Under communicable diseases, there was 1 case of Haemophilus influenza, 1 Lyme disease case, 1 case of salmonella, 1 case of Shigella, 1 case of yersiniosis, and 8 COVID-19 cases that were reported to the public health nurses, for a total of 13 communicable diseases reported and 12 investigations conducted. Under tuberculosis control, there was 1 patient who was screened and counseled, so we gave a PPD and then read that same PPD. There were 2 homebound visits provided for flu vaccine. There were 4 adults served in our 317 clinic with a total of 7 immunizations given, and that 317 clinic is for any adult who doesn't have insurance. In the VFC, so the vaccine for children, there were 10 children served with a total of 21 immunizations given in the month of September. And then some of the meetings that the nurses attended included the Morris County Public Health Nurses Regional Meeting, the Communicable Disease Forum, a COPA call related to a measles update, the Morris County Community Resource Day, and the NJAFNA, the New Jersey Association of Public Health Nursing Summit they went to as well.
Any questions on the staff reports?
Were there any, measles updates that are significant for us, the borough?
No, I think we're all remaining very vigilant, especially as guidance continues to change and may not be aligned with what we've known previously, but no big changes.
Okay.
Moving on to vouchers.
No vouchers.
No vouchers? Does anybody have any questions or concerns? I'm now at adjournment. I think this is our fastest meeting.
Yes, definitely.
I need a motion for an adjournment.
I'll make a motion.
I'll
I need
second.
a second. All in favor?